If you're anything like me, you're working at that bedside job, looking at the soft nursing jobs going, I'd be bored out of my mind, even though it sounds amazing, right? Bedside is ruthless. It's a rough gig. But let me introduce you to something that's kind of a best of both worlds situation. If you don't know me, I'm Reese. I'm a registered nurse and a paramedic, and I work on an ambulance as a registered nurse, as a critical care transport nurse. Now, what does that mean? Well, all that means is that I transport whatever the hospital tells me to transport. And that could be everything from a stub toe all the way to balloon pump or tube impellas or ECMO, anything that needs to go out of the hospital, I'm able to take. It's the perfect job for nurses who love the critical care side of things or the ER and just kind of don't like the politics behind it and the busyness and like to focus on one patient at a time, right? So my job is to take that one patient and treat them with the best care possible until they can get to the next hospital to get whatever care that they are going to need at that hospital. Now, don't get me wrong, there are some things that are critical to know about my job. Understanding that you have a lot more responsibility in the ambulance than you would at the bedside. Now, hospitals do tend to promote quite a lot of independence for nurses nowadays, especially in the new age environment where we're more short staffed than we used to be. But when you're on the ambulance, there's no one to ask. You can make a phone call and ask, but ultimately, you're the person who's going to be doing everything for that patient in the back of that ambulance. So you need to be on your game. You need to understand your protocols and what you are able to do and not do in the back of that ambulance. If you've ever looked at flight nursing and maybe looked at it and said, I'm just not there yet, or maybe I don't like flying, or that's just not the job for me, but I like the idea of what a flight nurse does, then critical care transport nursing is for you. It's a very new up and coming field, and it's something that many states don't actually even have. So you got to really look and peel through all the jobs to be able to find it. But if you can find it, it's one of the most amazing jobs that you can get on the market right now. And to answer the burning question in your head, yeah, it's about the same, if not a little bit more than my bedside counterpart. If you have any questions about critical care transport nursing, I would love to answer it. It's a passion field of mine because it melds my love of EMS for my love of nursing. So let me know if you have any questions.